Assalamu alaikum. The long clinical consultation day. First scenario, a male patient, 46 years old man, in the medical admission unit. He had presented earlier that morning with palpitation. His 12 lead ECG at the time showed fast atrial fibrillation with ventricular rate of 140 per minute. His symptoms have been now resolved, and his ECG shows normal sinus rhythm. His oxygen saturation 98, on room air pulse rate is 76 per minute, and regular blood pressure 134/80. The respiratory rate 16 per minute, temperature at 36. Please take history, examine him, and address his concern. You're ready, Dr. Maida?
Yes, ready.
Okay.
Hello, my name is
Hello.
Dr. Maida, one of the medical doctors. Can I confirm that you are Mr. Adam, 46 years old?
Yes, doctor.
Okay. I understand that you came earlier with a racing of heartbeat. Do you want to tell me more? What's happened?
Yes, doctor. This morning, after I took my breakfast, I feel heart racing. It was fast and irregular. Then my wife called the ambulance and bring me here.
Okay. Is this the first time to feel these symptoms, or you had it before?
Yes, doctor. I had it before.
Okay.
It happens twice. It happened twice before.
Twice before. Since when? You noticed?
First time was before 2 months.
Mhm.
And the second one was before 2 weeks.
Oh, 2 weeks. Okay. Apart from this irregular heartbeat, what do you feel anything else?
Yes, I feel like lightheaded, and I feel to lie down only.
So you feel lightheadedness. Do you ever felt that you lost your conscious while you have these palpitations or irregular heartbeats?
No, doctor, I didn't.
Okay. Do you have any short of breath?
No, also.
Do you ever had a chest pain or chest discomfort?
No, doctor.
Okay. And can you tell me, apart from that, apart from these symptoms you had, do you ever have like you lost your consciousness without this palpitation at all over this few months?
No, this not happened before.
Okay. Okay. And now the only thing that you brought you to the hospital that you feel your heart racing, but there is no any associated symptoms.
Yes, doctor.
Okay.
But it is stopped now. Now I am okay.
Yeah. Apart from that, do you have any symptom of cough?
No, doctor.
Okay. Do you have any fever at all?
No.
Okay. Do you feel generally fatigued and unwell?
No, I'm okay, doctor. All the time I'm healthy. Healthy lifestyle.
Okay. Okay. Do you ever been diagnosed before by any thyroid problem at all?
No.
Okay. Do you have any weather preference?
I don't know, doctor. What do you mean?
Okay. Do you have any weight changes?
No, my weight is stable.
Do you take okay. Do you have any change in your bowel at all?
No, it's as usual.
Any change in your appetite? Okay. Do you have any change in your appetite at all?
No.
Okay. And do you feel you are concentrating well, or there is any problem with concentration?
No, I didn't feel any problems.
That okay. Do you have any illness I should be aware of apart from this heart racing?
No, doctor, it's just heart racing.
Okay. Do you ever been diagnosed with high blood pressure at all?
No,
Okay. And you told me that you have no chest pain or chest tightness.
yes,
Okay. Okay. And this all these symptoms together happened over the past 2 months. Before that, do you have anything? Do you,
I'm well, completely normal, doctor, nothing.
okay. What about alcohol? Do you drink alcohol?
Just occasionally.
Occasionally. Do you relate these symptoms by any alcohol drinking?
I don't think, doctor.
Okay. Do you drink coffee
I drink, yes, in the morning coffee.
in the morning? And do you think that these symptoms related to coffee drinking, or there is no specific relation?
I feel this heart racing after my breakfast, and yes, I was take my coffee.
Hmm. And generally, are you love chocolates?
Not too much.
Not too much. Okay. How many times you drink coffee per day?
Only in the morning.
Okay. And normally, you feel this palpitation and this heart racing. If there is a specific time in the day you feel these symptoms, or it's not related to specific time?
Is this last time was in the morning?
Mm-hmm.
First time was after I take my lunch, and
Mm-hmm.
second time I can't remember.
Okay. Okay. So I will ask you some symptoms, and you can just tell me by yes or no. That's okay.
Okay.
Okay. Before that, you said this symptom of palpitation is on and off, isn't it? It's not
Yes.
continuous all the time. Okay.
Yes.
Do you relate it to a specific thing?
I can't remember any specific thing. But
Okay. Do you think there is any specific thing can ease these symptoms for you?
no, it is relieved, but by its own self. After a few minutes, it's relieved.
By itself. Okay. Do you have any fever?
No,
Any loss of weight?
no,
Any lumps or bumps in your body?
no,
Do you feel fatigue?
no,
Any headaches?
no,
Any visual disturbances?
no,
Do you feel any weakness?
no,
Any alter of sensation?
no,
Any shaking in your body?
no,
Do you have any alter of speech?
no,
Do you control your water work and bowel?
yes,
Okay. You said that you have no chest pain.
pain,
Pain, yeah. Any chest pain?
no, no, I
And
did not any chest pain.
okay, if there is any leg swelling,
No, doctor,
uh, you have no leg swelling, yeah. And do you have any vomiting?
no,
Any mouth sore?
no,
Any acid brush?
no, doctor,
Do you have any difficulty of swallowing or tummy pains?
no, doctor,
Any change in the bowel?
no, doctor,
Do you have any yellow discoloration of your eyes or your body?
no, I did not see any change in color.
Okay. Do you have any change in your water work?
No, doctors,
Okay. Do you have any bleeding from any orifices?
No, doctor.
Do you have any change pain or any joint pain or skin rash?
No, doctor.
Okay. Do you have any illness you should be aware of?
No, doctor, I'm okay all the time except this heart rate.
Okay. Do you have any family history of heart problem?
No, doctor, I don't know any problems in my family.
Okay. Okay, I can, what do you do for a living?
I'm a policeman.
Sorry?
Policeman.
Okay. Do you feel stress at work?
No, doctor. The ordinary stress.
Mm-hmm. Okay. How you manage with this symptom at work?
It didn't happened at work. It every time happened in my home.
Okay. Do you smoke?
Yes, doctor.
How many and for how long?
About 5 cigarettes for 5 years.
Okay. Generally, smoking can affect your health, and it also can affect these symptoms as well. If it's okay for you, if you can stop smoking, and if you need help, we can send you to a smoking cessation clinic. It's okay.
Okay, doctor.
You told me that you are generally not drinking alcohol a lot, like socially. I also advise you regarding this alcohol. Also, it can cause the palpitation and this heart racing and irregular heartbeat as well. Okay. And you told me about coffee, that you are drinking coffee just a small amount, just in the morning. Yeah.
Yes.
Okay. Do you have any surgeries?
No, doctor.
Okay. Now, can I examine you?
Yes.
Okay, I'll start examining you, and if you feel any pain or discomfort, just let me know. Okay.
Okay.
First, I will start with the general look of the patient, looking for if he's how he's look like, if he's overweight, if he's cachectic, generally if he's pale, if there is any pallor, generally looking cachectic pale.
John, he looks well, average body weight. No
Okay.
pallor, no jaundice.
Okay, then I will start examination by the arm. First, I will touch the arm to see if it is warm arms, and then I'll ask the patient to stretch his hands, looking for any tremor in the hands, and then I will check the pulse to check if it is regular or irregular pulse. If there is it
Regular. Now is irregular, no tremors.
okay? Then I'll ask for vital sign. If there is any specific thing in the vital sign.
No, that's
Yeah.
the scenario.
Okay. And then I will examine the eyes for any sign of Graves' disease and looking for pallor and jaundice as well. And then I
Mm,
will, if there is anything specific.
No.
Okay. And then I will go down to examine the neck for thyroid enlargement. And
No, normal cells.
nothing. I will ask the patient to open his mouth, looking for any angular stomatitis or anything specific in the mouth. And then I will examine the heart. I will examine the first, second heart sound, and I will examine for if there is any murmurs, specifically for a mitral valve murmur. And then I will examine the sign of heart failure, looking for if there is third heart sound by basal crepitations, looking for the raised JVP, and then I will examine the abdomen for liver, if there is any liver enlargement or there is a sign of pain in the liver, and then I will examine the lower limb for leg swelling. If there is
All
any
are normal.
no abnormalities.
Yes.
Okay. Okay, Mr. Adam, can you tell me what's your concern?
1 minute left.
Why, doctor, I have this heart rhythm?
Okay. So from the what we capture now, that you have what we call atrial fibrillation. That's mean your heart racing is irregular. There is irregular. We catch irregular heartbeat in your ECG. There is many causes. At the moment, we need to run some investigation to find out what causing the symptoms of the heart. Of abnormal heartbeat, this including blood investigations, and we may go further for imaging for your heart as well, gel scan to your heart to find out what causing it. The only thing that we need to be aware at the moment, we calculate a score that called chat score. This is a scoring we use if you need a blood thinner medication or no. Generally, in your age and from the what you are telling me, it doesn't sound like you need them at the moment. But most probably, we need to figure out with the heart doctor to see if that you need to some medication to regulate your heartbeat, or we may need to go further for retaining your heartbeat to normal. So we run this investigation first to see what's causing the irregular heartbeat. In the time being, I advise you to stop alcohol, or as you are
Okay.
taking social.
Time
Okay.
is up. Yeah, you already advised for alcohol and coffee. Time is up, Dr. Maida. 1 minute extra also added. Now we can go to the examiner question. Well done, by the way.
Yeah.
Let's start.
Present your case.
Okay. This 46 years old gentleman come with atrial fibrillation, paroxysmal type of atrial fibrillation. The risk factor in his case is caffeine and alcohol. He has no sign indicative of hyperthyroidism, or heart problem.
How many types of atrial fibrillation do you know?
The type we have paroxysmal atrial fibrillation. We have a persistent type of AF, and new the name it's one attack. Yeah.
Paroxysmal, you mean?
We have paroxysmal or persistent and
Permanent.
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 Yes.
Permanent, yes.
Continue.
How will you manage this patient?
Okay. I will start by investigation to find out the cause of this atrial fibrillation. It will be by basic investigation, including first bedside investigation, ECG, and then I will do blood investigation, including full blood count, liver function, kidney function, thyroid function test, and I will put him in telemetry for 24 or 48-hour tape, then echocardiogram. This is regarding investigation to find out the cause of his AF. In addition, I will do D-dimer, but in his case, he's low risk factor for having PE as a cause of his atrial fibrillation. Then I will calculate CHAP score, and I think also he's low risk factor for blood thinner medication at the moment. So most probably I will discuss with the cardiology to see if this patient for control of rate control or for rhythm control.
How will you treat this patient?
How you?
Will treat this patient?
This is at the moment. Just I will investigate and treat. If he's for rate control, I will start him on beta blockers, most probably bisoprolol. And with CHAT score, I think his CHAT score will be low. That means he will not be a candidate for apixaban or a anticoagulant. He's 46, so I don't think that his CHAT score is high. So most probably he's not for anticoagulation at the moment in his age. That's why I need to discuss with the cardiologist. He's for rhythm control.
He is for rhythm control.
Uh,
What types of rhythm control?
Rhythm control. I didn't get the question.
How will you treat the rhythm?
We have rate control or rhythm control. One of them.
And rhythm.
Yeah.
How will treat the rhythm control?
DC. You mean okay? Either chemical by amiodarone or DC cardioversion.
What's suitable for this patient? Pharmacological or DC?
His I think this is shock, but his paroxysmal is still DC cardioversion because he has no risk factor.
Okay.
He can benefit from DC cardioversion.
Okay, I finished my questions.
Okay, we have 20 seconds still. I will add some questions. You mentioned some blood tests. Do you think you should do some specific blood test for this patient? Specific.
Yes.
What do you think?
Yeah, thyroid function. Yes,
Yeah,
thyroid
perfect.
function test.
Okay, what else?
And I will check for troponin in this case.
Perfect.
Just to make
Yeah.
sure there is nothing.
Okay, you mentioned already the dimer.
Mm.
What do you think any importance of genetic testing in this patient? Do you think?
He said, I don't think, in fact, because he has no family history of heart
Okay.
problem and heart.
Yeah. Yeah, perfect. You mentioned already the echo, right?
Yeah.
What do you think other blood or cardiac test you can do for this patient if the echo is normal?
CT. So what this will CT cardio. What the name
Okay.
of that one?
You mean MRI heart?
Yeah,
Sometimes,
MRI.
yeah, to rule out valvular lesion. Okay, if all these tests were normal, do you want to do something to trigger or to? What do you think? Any test you can trigger the heart to check for any arrhythmia? What's called? Like stress
Stress echo.
Yeah, okay. I think fair enough the questions. We can start now the comment. Dr. Marwa, please.
In this case, if without structural heart disease, triggers maybe adrenergic triggers, physical exercise or emotional stress. But in this patient, there's no adrenergic stress. Yeah, these attacks happened while he is at rest. Attacks that happened at rest called fatal AF. Okay, it triggered, not triggered, but occurs at rest and after heavy meals. If it is adrenergic, they will guide us to treat him with beta blockers. But the fatal, may use flecainide because it is structurally normal. He will use flecainide at need as needed, only at attacks. دكتورة مايدة يعني اكسبلور اللي هي تريجر فاكتورز الكرونيك ديزيز any heart disease الثيرويد الكحول but she missed obstructive sleep apnea may be trigger for AF only drug, also drugs maybe but he deny any drugs she covered everything I have nothing to add.
Okay, thank you, Dr. Marwa. I will comment on Dr. Maida because I felt her confused. She started to analyze the complaint. Then she asked some question. She want to explore what could be the reason, right, Dr. Maida?
Yes.
Yeah, but your question was in the systemic review. Then when you ask the systemic review, you asked again the same question. You repeated some questions. So what's the best solution for that? What do you think? By the way, you start to ask constitutional symptoms, you ask about the appetite, but you didn't ask about the weight. So as I always recommend, when you start to do something, finish it. I mean, if you finish the complaint analysis, you want us to ask about possible cause as a differential. Here you can say heart disease, right? You try to ask about the heart problem, like chest pain and this is also accepted. You should do that, by the way. So you have to ask about awareness of heartbeat. How was it? Fast or slow, regular. You can tap to show him. But if he already mentioned to you, so you can skip. You can ask about the associated symptom. You ask already. But I wanted to ask about the chest pain. I think you asked later, but you ask it. Chest pain, awareness of heartbeat. This is related to the heart. Any leg swelling for the heart failure, any gasping for air while you are sleeping. All these questions to know the cause of his AF. Is it related to heart disease or something extra or away from the heart? Extra cardiac causes, I mean. Then you ask about weather preferences. Again, better to say, do you intolerate or you are having intolerance to any weather? Because some people prefer weather even he doesn't have any thyroid problem. For me, I prefer the summer, for example. For you, maybe you prefer the winter, but doesn't mean that you are having the thyroid disease as well as for me, right? So the best way, are you intolerant to any weather? Why? Because this patient, if he is thyroid patient, hyperthyroid patient, and you ask this question, and he said, no, doctor, I don't prefer, he might be thyroid and you miss the case. So the best way is to say, are you intolerant to any weather? Okay. So this is the second differential. So either thyroid, cardiac, or chest. You ask some chest question, but it's not as a systemic review. Earlier you ask as differential, I guess so. But I prefer not to repeat the question. If you already rolled out the chest symptoms or chest system as a cause, no need to repeat the question again. It will show the examiner that you are, first thing, disorganized. The second thing, you are repeated the question because you are not focusing. So the best way is to avoid repeating the question. Okay, finish the chest. You don't need to repeat the question. Let's go to the next thing after the relevant system. As I prefer my approach to ask about constitutional symptoms. Nothing in this patient. But you can add to this question, I mean, after asking lumps or bumps, night sweats, night temperature, high body temperature, and loss of weight, loss of appetite, particularly in this patient, you can add anemia as a cause of palpitation. So you ask about, anyone told you you are paler than before? By this way, you rolled out anemia, and it's one of the alarming or constitutional symptoms. Next thing, any past medical history of importance, he will either ignore or he denied. In this case, he denied everything. Now you can ask about the surgery, the medication. I guess you forget to ask about any history of medication intake, right? I think so. Or you ask,
Yes.
yeah.
No.
You will be in trouble if this patient is taking, for example, inhalers, salbutamol, for example. For any reason, he will not tell you that he's asthmatic unless you ask about asthma, or you ask him about any medication. Any medication can lead to tachycardia, even it can be the reason in this scenario, and you will miss the case. So the medication history added to the past medical history, surgical history, allergy also is important. Don't forget to ask all these questions as package. Ask about past medical history, surgical history, medication history, allergy, herbal. Herbal also can be the reason, as well as recreational drugs. This patient might be cocaine abuse, right? And it would be the reason of his tachycardia. You forgot also to ask about this.
Mm.
You have to ask in organized way. If you ask in organized way and you ask all the systems together, you'll not forget anything. You catch the case, but believe me, if something else, you might miss the case. The good thing here, you ask about the caffeine, which is very important, the alcohol. This question by experience. Stress as well, you can ask. You have any stress in your condition, it might be the reason. You can ask about exercise related, also it could be the reason. Then the systemic review as a quick systemic review. Any headache, any change of the sensation, any weakness, any change of your bowel habit, because you ask already about the chest and heart. No need to repeat them. Any change of bowel habit, any tummy pain, any change of your water work, any joint pain, any skin rash, then the family history, travel. Travel here also might be the reason if this patient have recently traveled abroad. He might have leg swelling, tachycardia, PE. PE also one of the causes. However, you will have some of the chest symptoms positive, like chest pain or short of breath, or even respiratory stress. But it wasn't in this scenario. Travel history finished. The sexual history, you have to ask, but it's not necessary because you don't suspect something related. Then the already the alcohol, the smoking, the job, and how you alter relating or the impact on your job. He told you, I don't have these symptoms while I'm in the job. But he said very important sentence. When I have taken my coffee, I felt this awareness of heartbeat. So you can say this is my case, but you have to have good differential. So be ready to say cardiac causes. Against that, he doesn't have any family history. He doesn't have any chest pain. The third diagnosis, the third differential, you can say, for example, the herbal or something patient is taking, drug-induced, or even respiratory cause, anemia. All this as differential, but you have to mention on the top of them the case, which was the caffeine or stress related. Okay. Examination, of course, in this scenario, everything will be normal. This patient was having paroxysmal AF. I think this is the case, paroxysmal, not persistent.
Paroxysmal,
Paroxysmal.
paroxysmal, yeah.
Okay. Then the examination, you have to focus on the pulse, the regularity, the even the equality between both arms, the delay even between the femoral and arterial, the pulse volume. You have to ask also about the posture hypotension, how the blood pressure sitting and standing. Why? Because it's related to the vitals, and pulse one of the vitals, right? Thyroid examination you have to offer by looking the jaundice, the anemia, and quick other system examination. In 1 minute you can finish. Abdomen, chest, you can hear, as you said, hear the chest or auscultate the chest for the murmur, and don't forget to palpate the apex or to show the exam that you are palpating the apex. I think it's nice case, and how to think about cause of palpitation is very important. It came before as also caffeine induced. I think also came as thyroid or hyperthyroid, thyrotoxicosis. So you have to be really good practice. Thank you, Dr. Marmor, for this case to refresh all of the members about the cause of palpitation in PACEs. Any comment, Dr. Marwa, you want to add?
Yes,
Add it to
في
mine?
point في
Yeah.
التريجرز الكافيين والستريس والاكسرسايز دوت ادرينرجيك تريجرز يكون الميديكيشن بتاعهم نديله بيتا بلوكر لكن في
Okay.
الكيس دي جات له in this case the attacks come in at rest and after meals and this vagal AF not adrenergic and the medication not beta blocker he will take flecainide at as needed during the attacks only. And we need to tell the patient you may have attacks in the future, and we will take medication during the attack only.
Okay.
You are talking about the management, the pharmacological option in this scenario. But
This is nice. In fact, but flecainide normally we give after we did
Yeah,
we do
exactly.
the
After
Echo to rule out
investigations
valvular.
and confirm. Oh yes.
Yeah, to rule out valvular lesion or any congenital heart disease. So even you want to say that, Dr. Marwa, you will refer the patient to multidisciplinary team approach, including on the top cardiologist, echo technician, other medicine doctor or specialty, some social support or social worker if he has some problem, and some lifestyle modification. This patient might have taken the alcohol extra or the caffeine also extra caffeine. I think need to give him some advices as Dr. Mayada. I like when Dr. Mayada addressed this point earlier. She said to him clearly, I need from you to stop and to reduce and to do so in order not to forget them at the end. That's why the time was up and she was about to repeat the advice. I told her time is up already, but the good thing, she already gave him the advices earlier. So she can get the marks regarding the management plan or communication in the management or the management plan in the communication skills. Apart from this, the management, if if you don't mention the flecainide, I guess it's not our job to specify what medication this patient should take. At least you have to know what the option for this patient, either rhythm control or rate control. In this scenario, I think it's clear that he's already rhythmic or he's sinus, so no need to rhythm control. He need to be on rate control, something to prevent the attacks again. And again, this is the cardiologist job, not my job to mention what I can give to this patient. I can give options, but it's not my job to prescribe for this patient the medication. Right, Dr. Marwa?
Yes, right.
Okay, but as you said, I will not change the management plan. This is your topic, you prepare it. As you said, the first option, this scenario is flecainide after ruling out the congenital or valvular lesion in this patient. Right?
Yes.
Anything else you want to add?
Yes. No.
So,
Important also to mention that we will refer the patient to cardiologist.
to what?
To mention that we will refer the patient to cardiologist.
Perfect, yes, okay. Any special advice in the practice you want to give here?
As you said, not repeat the question.
Okay. Thank you, Dr. Marwa and Dr. Maida. Any question from others? Any suggestion? Any comments? Dr. Maida, please write your scenario for Dr. Marwa. I will try to read the comments and open the discussion if someone want to add. Okay. Stress, yeah, stress echo. This is what I meant by my question, Dr. Maida. If your echo and everything is normal, you have to do or to think about stress echo. Dr. Marwa, well done. A bit late to start examining. Yes, the patient, though missing was if any family history of perfect. This question supposed to ask it clearly. Any family history of sudden cardiac death. I was about to ask or to remind you about this point, but already Dr. Marwa, thank you, Dr. Marwa, to remind us. It's not only family history of heart disease. You have to say any family history of sudden cardiac death or of sudden death, not cardiac death, because he doesn't know what's the sudden cardiac death. Sudden death. if he said, I can remember some of my family member died, you can ask more. At what age? Do you think it's related to his heart? And so on. Thank you, Dr. Marwan, for reminding. What about his mood? Yes, perfect. I already mentioned the stress and the mood. Chad's VASC score after rolling out rheumatic mitral valve cause of AFib on echo. Perfect. Dr. Dina, Alf Salama. Thank you, Dr. Dina. Maybe some exhaustion, not tired. Anyway, thank you for the question. Mrs. Yeah, the scenario. Dr. Maida, Dr. Marwa, your scenario. Mrs. Rawia presented with history of fatigue. Blood investigation revealed microcytic anemia. Thank you. Get ready, Dr. Marwa. When you're ready, let me know.
Okay.
Anyone want to comment? The mic is open now for anyone to comment.
We can start.
You want to start? Put good
Yes,
differential, Dr. Marwa, please. Because you will try to roll out the most common cause of microcytic anemia in PACES while you are starting. So if you're ready, let me start.
Sorry, the age of the patient. She's 42.
Okay.
it's okay.
Israel, 42 years. Perfect. Ready?
Okay, yeah.
Yeah, here you go.
Hello. My name is Dr. Marwa, one of the doctors today. Can I confirm you are Mrs. Rabi and you are 42 years old?
Yes, doctor.
Can you tell me, Ms. Rabia, what is your problem?
Okay, I go to my GP. He sent me here. In fact, recently I feel easy tired from anything I do, and he ran some blood investigations to me, and he said that I have anemia and low blood, and he sent me here.
I'm sorry for that, and we here to help you. Can you tell me when you start to feel this tiredness?
Over the past 3 months, I felt not myself. I become more tired and fatigued.
Is it the first time to feel this tiredness and fatigue?
Yeah.
And since this, is it increasing or the same?
Generally, I feel like I can't say it, but it generally just fatigue. I can't
It is
do the
worse.
thing. Yeah,
It worse.
it seems to be worse. Yeah.
Okay, I'm sorry for that. Can you tell me any specific time of the day you feel this tiredness and fatigue, or it is over the day?
All over today.
Do you feel any change in your period? Any change in amount, on frequency
Of what? Sorry.
of your? Sorry to ask you, but I'm asking about your period. Any
Oh,
change in amount or frequency?
yeah. It becomes scanty.
When it becomes scanty?
I mean, like also over this period of time, and before that, I felt like it's become more less. My normal cycle is around 5 to 6 days. This is in normal. Now it's become 3 days, and
Mm,
it's very scanty, not like before.
okay. Um, do you do you use any contracept any birth control methods?
No,
Any chance to be pregnant?
no,
Okay. Do you have any change in your
no. I
bowel
didn't
motion?
observe. No.
Did you notice any bloating or tummy distension?
Yes, I have a lot of bloating. In fact, my GP diagnosed me. This early, before the 3 months, you can say around 6 months. Recently, I felt like I feel some tummy pains and bloating and a lot of flatulence and gas. So I went to my GP and he said that it's a he said IBS. So he give me some medication to help that. Sometimes it works, sometimes it doesn't.
Did you notice this bloating and this uncomfortable sensation related to meals or no?
Uh, I can't. It's related to meals, to be honest. It's related to meals. Most of the time, I feel this bloating, and if I didn't eat, it will be better.
Any specific food you feel this uh, triggers these symptoms?
To be honest, I can't relate it to specific food, but most of the food called this symptom to me. This is what I felt.
Did you notice any change in color of your back back passage?
Color of the you mean
Back passage.
okay. No change in the color.
Okay. Do you have any difficulty in swallowing?
No.
Did you lose any weight?
Yes, I lose some weight.
How much?
You can say around a stone over the past few months, 6 months. But I put this down to I get to gym, so I put this down to that.
Mm. And how is your appetite?
No, I didn't observe any change in my appetite.
Did you follow any specific diet?
No, just I went to gym.
Do you feel any weakness in your legs or arms or anywhere in your body?
Apart from this fatigue, I have no weakness. No.
Mm. Did you feel abnormal sensation like tingling or breaking sensation?
Oh, you are right. Yes, I feel sometime tingling sensation in my feet.
Mm. Since when?
You can say around this period of time, all things become abnormal over this period of time. To be honest,
Sorry again for this. Do you notice any um, change in your gait or you feel any kind of imbalance while walking?
not specifically. No,
Did you fall before?
no,
Uh, do you feel any dizziness while changing your position?
not in changing my position, but dizzy. I feel dizzy normally, as I told you over this few months. I feel dizzy. Yeah.
Any change in your vision?
Not specifically, no. I can't. Sir,
Any change in hearing?
no.
Any headache?
Yes, sometimes. I can say most of the times, not sometimes. Yeah, I have headache.
How's it? Is severity of the headache? How severity?
Uh, it's aching. I can say ache. Around 4
Or
out
or
of
10?
10. Yeah.
Okay. Do you have any throwing up or
No,
feeling sick?
no.
Okay. Do you have any heart racing?
Yes, I have heart racing.
Is it regular or irregular?
Uh, it's regular and it's with a minimum activity. I feel my heart racing.
Is there any chest pain?
No chest pain.
Any shortness of breath?
Yes, I feel short of breath from minimum exercise.
Okay. Do you have any family history of conditions of concern, like blood disease or
Like, sorry?
like blood illness, blood problems? Anyone receive regular blood transfusion?
No, not specifically, but I think my mom has a same problem as me, that she has this anemia because of iron. They said that she has low iron. Yeah.
Did she receive any blood transfusion?
No,
Okay. Do you have any long-lasting condition, or do you receive any medication for any reason?
no. Just some medication for IBS. This what the
Mm.
doctor said.
Do you have any allergy for any medication?
No,
Uh, do you uh, did you run any surgical procedure recently?
no,
Sorry to ask, did you take any recreational drugs?
no,
Did you travel recently?
no,
Did you change your home or your workplace?
no,
Did you make any new painting to your home?
no.
Uh, uh, I need to examine you, Mrs. Rawia, and I will continue asking. What's your job?
I'm a teacher.
Is this symptoms affecting your job or daily life?
Yes, yes, a lot.
Mm,
I become really tired.
sorry for that. We will involve our social team to help you and the occupational workers. Do you smoke?
I do. I
Do
do.
you, how much for how long?
Uh, Not heavily. 10 over the past 10 years.
Mm. You drink alcohol?
Yes, I drink over the weekends.
How much?
Bottle of wine.
Mm. Firstly, we need to, I highly advise you to stop smoking because it is very harmful to your general health. And also, I want you to moderate your alcohol intake.
Okay.
I will start by general look,
Mm-hmm.
pallor, jaundice,
Pale.
weight,
The patient looks pale.
any jaundice,
No jaundice.
body weight, affect or overweight.
No, patient BMI looks around, we can say 23.
A pulse,
Uh,
regular, irregular,
Regular pulse around
uh,
88.
collapsing pulse.
Not collapsing pulse.
Mm. I want to ask you also, do you have any weather intolerance?
No.
Okay, I will look for thyroid also. Any thyroid,
Thyroid enlargement.
any exophthalmos or any eye signs?
Nystagmus, you said?
Eye signs, proptosis, exophthalmos.
Okay, no.
I will auscultate the heart and chest. Any murmurs, any crepitations, any
No
basal
palpitations.
abdomen for tenderness and organomegaly.
No organomegaly, no tenderness.
Lower leg for weakness and the sensation, and also sensation, a deep sensation and superficial sensation.
Okay. stock. You can see a sign of peripheral neuropathy.
Okay. I need to do. I need to see the gate and do rompering test.
2 minutes left.
Positive.
Positive. What's your concern, Mrs. Rabia?
Why have this anemia?
I highly appreciate your concern, Mrs. Rabia. And after discussing with you and examining you, I believe that you have a condition called celiac disease, that it is a problem in the defense system, affecting the absorption in the gut, make the absorption of iron and certain substance, certain important substance decreased, and result in manifestation like you have manifestation of low iron and also low other important vitamins. Do you have any other concern?
No, thank you. How can you treat this?
Firstly, we need to confirm the diagnosis. We need to run some blood test and some investigations to confirm this disease. And usually, this disease treated by prevent the gluten from the diet. And we will refer you to dietitians who will teach you what to eat and what not to eat, and we will give you the alternative of healthy alternatives. Do you have any other concern, Mrs. Raya?
No, thank you, doctor.
Welcome. I will give you also the website to read more about this condition.
Okay, time is up. Well done, Dr. Marwa. Let's start the examiner questions.
Okay. Can you present your case?
My case is a middle-aged female patient complaining of signs and symptoms of iron deficiency anemia due to celiac disease. The positive findings, a manifestation of anemia in form of fatigue, tiredness, feeling dizziness, and also manifestation of vitamin B12 deficiency in form of numbness or tingling, and there is peripheral neuropathy in examination, and positive rhombic sign. No signs of hyperthyroidism, no signs of thyrotoxicosis in examination and in history.
Why you are looking for sign of hyperthyroidism and hypothyroidism?
Because she mentioned in history that she have palpitation, she feels palpitation, and there is some weight loss.
Okay. Okay. So, what is your differential diagnosis in this case?
Iron deficiency anemia. Firstly, due to celiac disease.
What things led you to ask about, you think that it's celiac disease?
Because there's the symptoms of bloating, abdominal discomfort, and she misdiagnosed as irritable bowel syndrome, and there are also signs of decreased vitamin B12.
Okay. If you have time, what other sides of you want to examine in this lady? In examination.
I need to check also for hypocalcemia, chief sign or Turwasita sign. Also, I need to any back pain or
okay.
lower back pain.
How you can investigate this lady?
Baseline investigations, including CBC, will for looking for the hemoglobin level and CMV to know the type of this anemia, and the iron study, iron level and iron binding capacity ferritin level. Also, I need to do tissue transglutaminase and endomysial antibody test to confirm celiac disease. Also may do some invasive investigations like endoscopy, upper or lower endoscopy with biopsy.
Okay.
Upper endoscopy.
Okay. What is the gold standard for diagnosis of celiac disease?
Duodenal biopsy shows atrophy of the lung.
Okay. Okay. You said that the patient may have what you advise? What type of diet you advise the patient with celiac disease to have?
After confirming the diagnosis, I will refer her to dietitians, and the main advice is to avoid the gluten in diet.
Yeah, but what she can eat instead?
She can eat any product without gluten, like rice, oat. Meats, vegetables. Also, we need to correct her iron deficiency and give her make calcium level, vitamin D level, vitamin B12 level.
Okay. Which of the following is the most strongly associated with celiac disease? Regarding HeLa proteins, which is strongly associated with celiac disease?
I think HeLa B1, B2. I'm not sure. Not sure.
Okay. Time up, or we have time to ask questions?
If you have more questions, you can ask for teaching.
Okay. What nutritional supplementation patient with celiac disease you want to give a patient with celiac disease? In other words, what other deficiencies patient
I
with
need to give her a high iron content and high calcium foods.
Okay.
And avoid gluten, meat.
Okay. Yeah, I think this is enough.
Okay, thank you, Dr. Maida. Well done, Dr. Marwa. Let's hear the comment from Dr. Maida. Then I will comment.
Okay, so this is patient generally did well. This patient come with microcytic anemia. The good thing that you exclude the most common in her age, that menorrhagia. And this patient, it doesn't sound like she has menorrhagia, and she has, instead, she has a scanty cycle. So it will not be the cause of her symptoms. The other thing that we are talking about bowel disease, but still we can't exclude malignancy. She has bloating. Bloating can be a sign of many symptoms. One of them celiac disease, and it can still be sign of malignancy as well. You ask about change in the. I didn't correct me if I'm wrong. You didn't ask about change in bowel habits itself.
I asked
You
I
asked.
asked you
Okay.
a first question in GIT.
Okay, maybe I didn't hear that. Yes, so that's good. So, and lumps or bumps. And I want to hear about skin changes because this, if she has celiac disease, still she will have a skin change, yeah? She will have, which one? Dermatitis herpetiformis. She may have itchy skin, blistering of the skin. So
Yeah, and vitiligo as possible as well.
and vitiligo, and yeah, all these symptoms. We need to ask about it in her case. And you asked me about yeah, it's still also you asked me about stool, so she has no diarrhea, and we need to ask about constipation in specific. You ask about the diarrhea, but not constipation.
I asked you any change in bowel
Constipation.
motion.
Yeah, okay. But I think if you ask specifically,
She
please,
have constipation, this patient?
you need to ask her. She has no constipation in her case, but we need to ask about it because sometime celiac disease still can come with constipation. Okay, you ask the good thing that you ask about the weight loss, but you need lump sum bumps just to make sure that this is not a case of malignancy.
Malignancy.
This lady have shortness of breath and she has anemia. I will be worried about heart failure. So I want to ask her about other symptoms of heart failure, that orthopnea, paroxysmal nocturnal dyspnea. And when I will examine, I will be sure you examine the heart, but I will examine the base of the lung, looking for any crepitation. I will see the JVB. There is any raise of JVB, lower limb swelling. So I will make sure that she has anemia, but she has no complication of anemia. She has no heart failure in addition to her symptoms. She has fatigability and everything. I will make sure she has short of breath. I will ask more question about how she is managed at home, that how distance she can manage before she get tired and fatigue. If there is any help at home, she work as a teacher, and this is affecting her job, and you ask for occupational help, but how she can cope at home. She lives alone, and how this symptom affecting her for her daily activity and how she can manage. So I think this is important in this lady as well. I will ask in examination as well. I will see if there is mouth ulcers, because this one the important whenever you are having a GI, the entrance of the GI symptoms system is the mouth. So always have a look in the mouth. So I will see if there is mouth ulcers or no. Okay. You tell her about the gluten, but you need because the gluten is common thing, and you can't. You need to give her some alternative. The good thing that you refer this patient to the dietitian, but you can advise with. We have 3 things: potatoes, rice, and the third one is goat. Yeah. So this is the 3 things that is best without gluten. There is no gluten in it. Oat and rice and potatoes, I think. Then what question? Okay.
The HLA.
Yeah. So So it will be HLA DQ2. This is the one is associated with celiac disease. And the gold standard, you said the gold standard is the duodenum biopsy. It is the duodenum biopsy. good for that. And then we'll give this patient supplementation in addition to advice with dietitian and everything. Yeah, I think this what we have here. Thank you.
Thank you.
Yeah, as usual, we will start to do screening by IgA antibodies. And if it's normal, Dr. Marwa, what we should do?
IgG.
Yeah, you have to check for IgG level. You have to be ready for this question at any exam with celiac case. Thank you, Dr. Maida. Well done. As a topic preparing, the case was common. Yes, the celiac as one of the iron deficiency causes. It's very common, and it might be presented with anemia. As usual, you can add to them calcium deficiency, osteomalacia, osteoporosis, uh, even the vitamin B12 deficiency, folic acid deficiency. All this manifestation might be presented, or any patient with celiac might be presented with. But let's talk about this scenario particularly. As Dr. Maida said, Dr. Marwa started to roll out the most common in the female childbearing period. She rolled out the iron deficiency anemia due to menorrhagia, but it wasn't the case. But still, it's one of the differential hyperthyroidism because this patient is having scanty periods, but it's not as a anemia cause. It could be the differential of fatigue. Back to the relevant system. In this scenario, the fatigue, the constitutional symptoms, you should ask all constitutional symptoms in this scenario. If you have, as Dr. Maida mentioned, if you have lost weight or weight of loss, sorry, loss of weight or loss of appetite with this GI manifestation, you can suspect cancer colon, particularly if this patient is having family history of cancer colon. Back to the patient again. The,
شكرا ماما.
the good thing in this scenario, and as iron or iron deficiency anemia, or sorry, if you suspect celiac as autoimmune disease, there is good differential as anemia, as a cause of anemia, but it's not in this scenario. What is Dr. Mar? What do you think the other anemia in this scenario could be the reason related to autoimmune as association or as a differential? It's very common cause, but it's different type of anemia associated with autoimmune disease.
Anemia of chronic disease.
Another type of anemia associated with
Hemolytic.
no, another type. I mean other type,
Macrocytic.
which
All
is
associated.
yeah, macrocytic
pernicious.
pernicious anemia. Yes, this is what I
ما هي
mean.
macrocytic.
Yeah, that's why it is against the differential because it's macrocytic. That's why it's good not to mention it. By the way, it's perfect not to mention the pernicious anemia as a differential. However, this patient is having autoimmune disease. This is a good thing you didn't put it as a differential. Why? Because it's macrocytic. Don't say pernicious anemia as autoimmune disease associated with celiac. Don't mention it at all. This is a good point. I mean, it's against the differential, so don't put it as a differential. Back to the celiac and the association of celiac. I think the question for celiac, Dr. Marwa, you didn't ask in details, like the food relation, the flushing, the flashability. I mean, is it flushable or
I
no?
ask about food, but she has no change in bowel. To ask about flushable. No change in bowel.
She doesn't have diarrhea.
Mm. Yes.
Okay. Yeah. Okay. But you mentioned the pizza, pasta, and
I asked her it is related to any food. She mentioned she is not sure about the
you
specific
have to
food.
specify question. Yeah, pasta, pizza. You have to specify the question related to this food, type of food, not only food. Okay, because
Okay.
if you tell the examiner my differential is celiac, he will ask you, did you ask about the type of food she has this,
Mm.
right? The symptoms
Yes.
related. So better to specify them, and we know all of us know them. Even the wine or the alcohol related is beer, right? You have to ask, do you think the beer may be the trigger of your symptoms? Sometimes it
Mm.
comes as beer related. So you'll be in
Yes.
trouble if you don't ask about. Even she told you, no, I don't think it's related to the food, but you are suspecting celiac disease. You have to specify a question for the beer. Is it related to their beer? What type of alcohol you are drinking, and so on. Okay. Again, as general, Dr. Marwa, really perfect. You are in the good track. You are asking good question. You know how to explain any disease. You know how to address any concern. You know how to examine any patient related to the complaint. The differential. What was your differential? Or what were your differential? I don't
Yeah.
hear. I didn't hear any differential you put, right?
Celiac
Okay.
as a cause of iron deficiency anemia or uh, malnutrition or malignancy. Dr. Maida said malignancy.
Perfect. So you have to give me causes of microcytic anemia.
Mm.
Microcytic causes of anemia. The first
Mm.
one in this scenario is it's related to iron deficiency because of celiac disease, right?
Yes.
The second one is iron deficiency related to possibly.
Malnutrition.
Okay, malnutrition again, the celiac disease.
Mm.
Or as you said, cancer colon,
Malignant.
IBD بقى يعني we can put IBD Crohn's.
inflammatory Crohn's.
Yes, causing malabsorption the same way.
Um, I'm not sure if we can put the Crohn's as differential in this scenario, particularly if there is no blood loss, right? This patient denied any
Yes,
blood.
yes, not always the loose motions is bloody in Crohn's in specific, but the same criteria, loose motions, tummy pain, young age, autoimmune, and also malabsorption.
Mhm.
So I think IBD will fit with this if you see.
Okay,
Yes, maybe and differentials.
okay. I think this is the case. Any question or added point I missed or Dr. Maida missed? Thank you, Dina, for your differential. Anyone want to add any differential or
Yes.
yes?
Then,
Go ahead.
we can arrange the approach according to the differentials. Okay. If there is any anemia, we need to ask if there any bleeding from any other body orifices. And apart from menorrhagia, we can ask about black tarry stools. Sometimes there is peptic ulcer leading to this bleeding. Okay, so sometimes it go unnoticed. So we need to ask about black tarry stool and any bleeding from any body orifices, and you need to mention some examples like bleeding from the nose, from the gums, heavy period, and cola colored urine, for example, and this can go with hereditary hemorrhagic telangiectasia. And we need to ask about over-the-counter medications, in specific over-the-counter analgesic non-steroidals can lead to iron deficiency anemia, and the bleeding can go unnoticed. Okay. And the blood thinning medication. Apart from that, you mentioned it all. Okay.
Yeah, perfect. So as Dr. Dina said, she want to make a differential for iron deficiency anemia in young patients. Added to what mentioned by Dr. Marwa, the celiac disease in this scenario, cancer colon as a possibility. Yes, Crohn's can be, but you have to rule out any bleeding from anywhere, either the nose as HHT or UTI, or sorry, from the genitourinary system as hematuria, recurrent hematuria. Drug induced, of course, on the top. It came as a case post non-steroidal anti-inflammatory drug ulcer or peptic ulcer related. It might be the case, by the way. So the over-counter medication as a question or medication for any reason or without medical advice can solve the case. Be ready for this case. It's not only the food relation, it might be related to the over-counter medication. Take care about every question. If you don't reach to the case, try to approach more to know what was the cause or what is the possible cause apart from the food relation as in this scenario. Thank you, Dr. Dina, for your approach. Any
Yes,
other?
and if we
Yeah.
we need you need to put colon cancer, we can ask about the family history of colon
Sure.
cancer
Yeah.
by name, يعني in specific.
You should.
This young age.
This is specific and direct question.
Yes.
Any family history of note, or any family history of the same condition, or any family history of cancer colon,
Yeah, sorry.
particularly. Yeah.
Yes, I'm another thing. I'm sorry. I want to add this celiac associated with malabsorption. So all the ADEK is low. So there is night blindness associated. There is liability for bleeding for the deficiency of vitamin K, osteoporosis, deficiency of vitamin D, and easy bleeding, vitamin K, night blindness, osteoporosis. Yes, and the vitamin B12. Vitamin B12 also leading to tingling, numbness, and imbalance. You need to ask about all of these in your scenario. Yes, and you can also put in the investigations. I need to check the albumin, vitamin B12, iron profile, vitamin B12, folic acid, calcium, and vitamin D. Clotting factor BT will be prolonged in vitamin K deficiency, like that. This is the investigations for malabsorption conditions, all the malabsorption conditions. And the more specific, the celiac antibodies, upper GI endoscopy, biopsy, as you mentioned.
Peripheral neuropathy, and Dr. Marwa did it on time. She examined.
Yes, yes. The voice, I can't hear anything. And I think in the exam, we need to examine, as Doctor said, the cardiovascular system. Yes, and the abdomen. This is the most important to examine, apart from general.
Yeah. Sorry, it was interrupted internet for me.
Okay.
You can hear me now?
Yes, yes, yes.
Yeah, so peripheral neuropathy should be examined as one superficial and one for the deep sensation. In this scenario, it would be positive. Both superficial might be lost along with the deep sensation. Plus, the Romberg test, which would be positive in this scenario as vitamin B12 deficiency. Any other questions or suggestions? Any added point, Dr. Maida, we missed? Dr. Marwa, you want to add anything?
No.
Perfect, Dr. Marwa. You are doing well.
Thank
I
you.
lost, yeah, thank you. Thank you, Dr. Dina. I lost the chat. I don't, anyone can read the previous message? I think Dr. Ihda wrote the DH, the correct answer for the HLA, DQ2 and DQ8. After this
Yes.
comment, I lost already. Anyone can mention what written in this chat box, please? Someone
Nothing
can read.
more. Nothing more. This is the last.
Okay. Okay. Thank you, Dr. Dina. Thank you, Dr. Marwa and Dr. Maida. Any question, any suggestion before ending the session? Any doubt? Okay. Thank you, Dr. Muhammad Omar, also for comment earlier. Anyone want to add anything before ending the session? Okay. See you with the next communication day. Thank you, everyone. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.